Good morning, Peter Goertz. I'm a psychiatrist. Let's talk about honesty in the doctor-patient interactions, doctor-patient relationship. Is it a good idea to be honest with patients? Of course. And nothing's perfect, but as much as possible. And what came up this week was a resident that I'm supervising, so a psychiatrist in training, had seen a patient, young patient, I think very early 20s, and the patient was living with his mother, and we needed to get some information about the background of the patient in his childhood from the mother. And during that interaction with the mother, the resident told the mother something that the patient may not have wanted the resident to tell the mother. So that can be an issue, and how to handle that. So when the resident told me that, I suggested to, when she speaks with the patient the next time, which was going to be, I think, the same day or the next day, she was going to call him anyway, to let the patient know that she had said that and apologize and let that be then. And as far as I recall, she did, and things went fine. So honesty with patients, in my opinion, starts with being honest with yourself, looking in the mirror, and that can be one of the most difficult things to do. So I think we all want to practice that and do that on an ongoing basis. So you're going to get all kinds of questions from patients at some point, and it could be something like, have you ever used street drugs? How are you going to answer that? And everyone has to decide for themselves. You could say, if you want, you can say, I used this and that when I was a teenager. Or you can say, I think it's better for me not to answer that. Let's focus on you during this visit. And you're still being honest by saying that. You're not answering the question, but you're still being honest. So that's better than, if you have used drugs in the past, that's better than saying, no, I never used drugs in my life, in my opinion. And same thing can happen. Let's say they ask you, are you married? And actually recently, a patient said it would be nice to go out on a date with me. And I'm not even sure how I responded. I may have just said thank you, and that was it. This is a patient I've been seeing for years, and she was saying it in a somewhat humorous way, but I think also there was a serious part to that. You can get questions like, are you Christian? And that can be a little touchy if people do not like other religions. Let's say your patient does not like Christians, let's say. Are you gay? Could be another question. How often do you have sex? So all these are questions that may potentially make someone uncomfortable if you're treating a patient. So other interactions can be difficult also. For example, years ago, I was working on an inpatient psychiatric ward, and unfortunately, hopefully this wouldn't happen today with computerized medication administration. So what happened then was that patients, because of a mistake, were getting offered each other's medications. And some patients didn't notice it, which is understandable, and they took each other's medications, which can be very dangerous. So that actually happened. It sounds like some prank or joke, but unfortunately it actually did happen on an inpatient psychiatric ward. And how to deal with that then? At that point on the ward, there was a very caustic, angry patient who was very critical of staff, didn't want to be in the hospital. He was my patient, and he had been offered someone else's medicine. Luckily, he realized that it wasn't his, and he didn't take it. But how to deal with that? And I felt similarly to now that it's best just to be truthful. So I went and told him openly what had happened. And surprisingly to me, he was very courteous and accepted that, and the matter was put to rest. So you never know how people's reactions are going to be, but whether or not he became angry, to me it seemed like the right thing to do. Another situation which can be unpleasant is if a patient of yours commits suicide or a violent act, how to interact with family, let's say after a suicide of a patient. So in my opinion, again, you want to be truthful. You don't want to be self-deprecating. You don't want to grovel, but you do want to be truthful and say what happened and also how you feel about it. You want to be a human being and express your feelings. And that reminds me of another situation, and adverse outcomes can happen whether or not you've made a mistake. So at one point, again, way back when I was working on an inpatient psychiatric ward, one morning, a young female patient of mine on that ward was just found dead. We had no idea why. I don't think anyone ever found out. She was in her 20s, I think, and was just found dead in bed in the morning. And on that ward, we used to have community meetings with staff and patients, intermingled. We would sit, staff, patient, next to each other. And that morning, I asked to run the community meeting because that happened to my patient. And we just went around and we all expressed our feelings about what happened. And of course, you can imagine if a patient of yours just is found dead, you potentially could question yourself. You may get angry, sad, various feelings can come up. And it's a good idea, in my opinion, to express that in a community meeting. And that meeting, as far as I recall, went well, if you want to call it that, but it does help to process things like that. Now, you also want to be honest in writing. So if you're writing notes about patients, and let's say a patient comes in and is rude, curses at you, you probably do not want to use the word rude. You want to just be descriptive. Say, patient came in very angry, cursed at me or whoever it was, and that's that. Just be descriptive. Similarly, if a patient is manipulative, wanting to twist your arm to give the patient Xanax or another controlled substance, Adderall, and you don't feel that's appropriate, you don't want to write in the chart manipulative, but you can be just descriptive again and say, this patient presented today requesting that I prescribe 6 milligrams of Xanax a day for him. And that's that, without adding your own interpretation that the patient was manipulative. And another term I would avoid is drug seeking. Basically, you want to avoid terms that are derogatory, and also you want to, if in doubt, be descriptive rather than giving your own evaluation of the situation. Thank you.